Dear colleagues, first of all, I am really grateful for the opportunity to present here the current progress in the detection of hereditary disorders in preimplantation embryos in Russia. In addition to a brief overview of the development of preimplantation genetic testing, I will focus on the activities of the reproductive genetics section at the Russian Association of Human Reproduction, which I represent here. As this is the first time we have an opportunity to speak here, I will begin by saying that since the second half of the 20th century, our country has paid special attention to reducing child mortality and health of the offspring. During this time, there were many important achievements in vaccination of children and pediatrics in general. In 1987, the first national project to prevent the birth of children with chromosomal abnormalities was launched in St. Petersburg. The successful experience was expanded to the whole country at the end of the 1990s. A protocol of screening has been now established to enable all pregnant women to undergo biochemical and ultrasound examination free of charge. If necessary, it includes methods of invasive prenatal diagnosis. In recent years, prenatal diagnosis has been developed thanks to the new non-invasive testing methods, but so far their effectiveness has been under investigation in the framework of scientific research and evaluation. For those who wish, this method is also available for a fee. Neonatal screening became available for everyone in 1993. At that time, the tests were carried out for only 2 diseases. From 2006 to present, screening has been carried out for 5 genetic disorders. It is planned to expand neonatal screening programs to 36 diseases. Much attention is paid to the early detection of diseases before the onset of symptoms. The earliest detection can be achieved through the establishment of 3 new genetic centers and the development of a national program. Preimplantation genetic testing within IVF programs is the earliest possible method to prevent the birth of children with hereditary diseases, including chromosomal and gene defects. The first clinical use of PGT in Russia was reported at the end of the 20th century. The first genetic laboratories in IVF clinics in Moscow, St. Petersburg, and Siberia were established with the support of Yuri Verlinsky. Since 2000, information on IVF cycles using PGT has been included in the annual registry of the Russian Association of Human Reproduction. Today, the number of centers providing such information is over 100. The number of IVF cycles with PGT is increasing every year. In 2019, their number reached nearly 15,000. Of course, the pandemic slowed down the work of IVF clinics in 2020 and 2021, but we do not expect a significant decrease in this year's reports because the most vulnerable categories, including carriers of translocations and monogenic diseases, and especially aged women at a high risk of fetal chromosomal abnormalities, tend to continue treatment as soon as restrictions were lifted. Data on successful pregnancies followed by IVF cycles with PGT show an increase with the transition to new technological platforms about 10 years ago. This field has undergone significant advances in technology, from the study of single molecular markers by PCR and FISH to whole genome sequencing on single cells. At the beginning, aneuploidy analysis was possible only for a couple of chromosomes, and now it allows detection of abnormalities not only in all chromosomes, but also in individual segments. This greatly enhances the possibilities of PGT for structural chromosomal rearrangements and increases the significance of PGT for monogenic diseases. In total, more than 7,000 children were born after IVF with PGT in Russia, according to the registry. Significant growth coincides with the transition to new molecular technologies that allow us to study all chromosomes of the set and the availability of cryopreservation methods. PGT technologies began with the idea of preventing the transmission of inherited disorders to the offspring during IVF procedures. Modern reproductive genetics focuses on a range of issues that include genetic and epigenetic aspects of both natural and assisted reproduction. This field is constantly evolving due to the rapid technological advances. In 2019, we decided to organize a section of the association members specializing in PGT and reproductive genetics. At the first meeting of the members, Dr. Жанна Глинкина was elected as its head. The purpose of the section is to assist IVF specialists by introducing in the clinical practice modern molecular genetic technologies and techniques aimed at solving the main task of IRT, birth of a healthy child. The main purpose of the section members is to raise awareness and understanding of the role of genetics in reproduction, as well as to bring together novel insights of research studies on the PGT and reproductive genetics to stimulate discussion and encourage research. We hold regular meetings, workshops, and roundtables to discuss the current status of different types of genetic testing and create expert recommendations. Such meetings help to highlight our achievements and challenges and encourage further communication and networking between PGT scientists. They didn't stop during the lockdown but moved to an online format, allowing the audience to expand significantly and bringing together experts from different parts of our country. Among the most significant and interesting achievements in the field of PGT in Russia, in my opinion, the following are worth highlighting. Birth of healthy children in families where both parents are carriers of different reciprocal translocations. First case in Russia in 2012. There are already several such cases. Implementation of the second and third generation sequencing in PGT-SR in order to distinguish embryos with balanced translocation from normal embryos. Development of artificial intelligence technologies to improve the reliability and efficiency of PGT. Birth of a healthy child in a family with a high risk of a monogenic disease directly detected with preconceptional screening. It means that it was done without a history of having a sick child in a family. In conclusion, I would like to tell you about our future goals. Collect prospective and retrospective data on the accuracy, reliability, effectiveness, and safety of modern genetic technologies. Evaluate the appropriateness of genetic tests and develop standards for the use of genetic testing in reproduction. Organize and conduct educational activities to improve the skills of our specialists and promote best practices. Create the evidence base for inclusion of genetic testing in the state support programs. The last of the above points is obviously not the least because it underpins the development of potential through increased accessibility. The Russian Ministry of Health pays much attention to preconception screening. Since 2019, regional budgetary programs have been launched to finance screening of the recently married couples for the most common mutations. In St. Petersburg, the screening originally covered 2 diseases, but since last year it has included 3 diseases: phenylketonuria, cystic fibrosis, and spinal muscular atrophy. Since 2021, for couples with a high genetic risk, IVF programs with embryo cryopreservation have become available through health insurance programs. Unfortunately, these programs do not yet include genetic testing itself, but they are already significantly increasing the accessibility of the procedures and public awareness. Today, our most important goal is to prepare justification and rationale for including genetic testing for carriers of monogenic diseases into the list of reimbursable IVF costs. This will help to take advantage of preimplantation screening within IVF and to reduce the number of children born with genetic disorders. Thank you for your attention.